Hello everyone, I am Tia Gwenny Colracolas from BSN 111H, a first-year nursing student from Davao Doctors College. So for today, I will be performing a hair, skin, and nail assessment return demonstration. The skin is actually the largest organ in our body, and it belongs to the system called the integumentary system. So the integumentary basically means the outer cover part and the first line of defense in our body, which serves us to protect from hazardous substances and against the invasion of microorganisms. So, some certain diseases or illnesses often manifest themselves through our skin. That is why we need to take care of our skin and perform skin assessments. Now, the first we need to do is review the client's medical record because this will allow us to get basic information about the client and the scope of assessment needed so that we can prepare the equipment prior to meeting the client. So the next thing that we need to do is to prepare the necessary equipment for this assessment. Now I have already reviewed the client's medical record and also already prepared the necessary equipment for the assessment. So I have here my notebook and pen so that I have something to write on my subjective and objective data. So here, also the clipboard. Next is my pen light for lighting so that I can clearly see the characteristics of my patient later. I have also here the non-sterile gloves. Since I'll be touching my patient, I need to use this to avoid cross-contamination. And the last one is the alcohol for hand hygiene. Now that I've already prepared the necessary equipment that I will be using, let's now start the assessment. Hi ma'am, kumusta po kayo?
Okay lang.
Are you comfortable here ma'am?
Yes.
Is the lighting good?
Yes.
Okay. Thank you po ma'am. So I am Pia Rocalas. I'm a student nurse from Davao Doctors College. So I'll just have to perform hand hygiene. You can have this up po. This is done to avoid the spread of microorganism or the bacteria. So, confirmation lang po ma'am. Can you tell me your name?
Aliyah Mir Lagurin.
What do you want me to call you?
Aliyah.
Aliyah. Okay, Miss Aliyah. Just for verification po, may I ask when was your birthday?
May 15, 2000.
So how about your age po?
19 years old.
Okay, Miss Aliyah, basically I will assess your hair, skin, and nail today. So for the procedure, I'll ask some certain questions and you will answer it honestly po, okay? And I just wanted your full cooperation po. And for me to be able to assess those parts, I'd like to ask for your consent to touch certain parts of your body. Is it okay with you po?
Yes.
Okay po, Miss Aliyah, rest assured po that all information that I will be gathered today will remain confidential and only be available for healthcare provider, including me. Okay. So this time, before we start the assessment, I'd like you to wear this gown and remove all your pieces of jewelry, and that includes your watches, necklaces, bracelets, etc. Okay po ma'am, I will meet you after you're done, okay? Alright, while the patient is changing, I will provide her privacy by closing the door and closing the curtain. So, are you done, ma'am?
Yes.
Thank you. So, Miss Aliyah, before we start the assessment, I will be asking you some questions about the current condition of your skin, okay?
Okay.
Do you have any question, ma'am? Or any clarification po bago tayo magsimula? So, now, Miss Aliyah, I'll be getting the history taking. It is the staple essential backbone for making an accurate diagnosis, which enables the clinician to make a provisional diagnosis in most cases. Okay po, have you noticed any redness of your skin?
Yes po, rashes.
Okay. Can I see the area po where the rashes is located? So you have rashes po. Is it itchy or does it sting?
Itchy.
Itchy. Okay. Alright, so both of your arms contains the rashes, right? So, Miss Aliyah, what do you think triggered the rashes?
Ano po, dahil sa sabon po na ginamit.
Because of the soap. So how intense is the itchiness? Can you rate it from 1 to 10 with 10 being the worst?
5.
Okay, 5. So, Miss Aliyah, do you take any over-the-counter medications?
Yes po, yung cetirizine.
Or ointments po, ma'am? Okay. So, how about unusual darkening or lightening on your skin?
No.
No. Do you have any tattoos po ba?
No.
So, have you had any change in the condition or appearance of your nails?
No po.
Okay, no. How about your hair loss po? How about hair loss?
Yes po. Minsan.
Okay. The next question po will be about your past health history. This information gives the nurses and doctors all kinds of important clues about what's going on with your health because many diseases run in families. So is it okay for you, ma'am?
Yes.
Do you have any previous problem with your skin, hair, and nails?
Yun po yung sa rashes tapos yung hair loss ko.
Skin, hair loss, and rashes. So how about allergic reactions po? Do you have any allergies on food, medicine, or drinks?
Ano po, sa food.
What kind of food po?
Yung shrimp.
Shrimp. Okay. Did anyone from your family experience any skin problems or skin cancer?
No.
No. Okay, but for your current lifestyle po, how long do you usually expose yourself from the sun? Usually how many hours?
30 minutes.
30 minutes? Okay, ma'am. So how about your exposure to chemicals po? Do you use any lotions or any skincare products?
Yes po. Lotion po.
Okay, lotion. Is it for moisturizing, hydrating, or skin whitening?
Moisturizing and whitening.
Okay. Do you have any routine for your skin, hair, and nail care po?
Yes po. Ang pinaka-basic is I just take a bath.
Take a bath. So what do you usually eat on daily basis? On breakfast, lunch, dinner, or snacks?
Rice and mga ulam.
Is there anything at home that stresses you? So how do you usually manage your stress po, if there is any?
Kumakain tapos watching movies.
Okay, watching movies and eating po, no? So, Miss Aliyah, since nakabihis na po kayo, I'll now proceed for the assessment. Are you ready po?
Yes.
Okay. So, in hospital setting, the patient don't usually wear clothes under their gown. But since that we were just doing the demonstration, we'll just have to let our patient use comfortable clothing. Okay. So first, let us perform hand hygiene and then wear a gloves. So now po, ma'am, I'm done wearing my gloves. Can I check your skin po? Okay. So generally po, ma'am, I can see that your skin color is consistent and I don't see any hyperpigmentation or any discoloration on your skin. I also did not notice any unusual odor emanating from you naman po. Okay. So so, ma'am, this time, may I see your scalp and hair po? I'll just check po if my scars and lesions po ba, okay? So, basically, I am just palpating and inspecting her hair for any scars or lesions that are present. So, what I wanted to look for is for even distribution of hair, thickness, moisture, texture, or if there are any bugs, lice, and dandruff. Okay, thank you so much po, ma'am. I'm done. So, once I'm done with the hair assessment, I'll remove my gloves and properly dispose them. And I need to perform hand hygiene to avoid contamination. So, ma'am, I didn't see any scar on your scalp po. There are also no lice, dandruff, and the moisture and the texture are good. And I see that your hair is evenly distributed on your hairline, eyebrows, and lashes. So ma'am, I can see that you're really taking good care of your hair po. And moving on for skin assessment, first I will check for her skin color because this is important for additional diagnostic signs. Ma'am, may I see your skin po? You can close your eyes po. Can I see your forearms po? Thank you so much, ma'am. So, Ma'am Alia, I can see that evenly pigmented naman po ang skin nyo. Wala din pong darker or lighter areas. There's also no signs of yellow skin colors for jaundice that could indicate liver, gallbladder, and pancreas problems. However, I see that you have reddened areas on your skin on your left and right forearms due to the rashes that you complained earlier. So this time, I'll be palpating the skin of my patient. I'll be using the dorsal or back of my hand because some nurses believes that it is more accurate to measure temperature, moisture, and texture. So, Ma'am Alea, may I touch your cheeks and your part of your head? Okay. Okay, ma'am. So, the moisture is good and the skin is warm to touch. Texture is smooth and the skin is not too dry and not too oily. So, Miss Alea, may I have your forearms po? Okay. So, the skin moisture is good, not too oily and not too dry. And the temperature is normal. So, normal temperature is 36 degrees Celsius and above and below of this temperature is considered hypothermia and hyperthermia. So, inflammation and tissue of the skin can cause changes in skin temperature, which is why we need to assess the temperature po, ma'am, no? And I also have to take note of dry skin areas of yours that could indicate dehydration or excessive use of soap. So, this time I will be checking the texture of your skin, ma'am. So, the skin texture of your arms is smooth, but your palms are rough. This is usually because of your calluses no, that are exposed to constant pressure, so it's normal. Okay, Miss Alea, this time I will check for your skin mobility. So I will slightly pinch the back surface of your hand now. So, okay. Can I have your hand pulled? Okay, so I can see that your skin finishes easily, which is an indication that you have a normal skin mobility po, ma'am. And also, turgor is elastic, meaning nabipinat po siya or nababanan po siya. Since it went back to its place right away. Okay, this is an indication that you are well hydrated po, ma'am, no? So, earlier, I expected for rashes of her right and left forearms. Now, this time, I will wear gloves to apply pressure on those arms and on those areas and assess for blanching. So, I will get non-sterile gloves and perform hand hygiene. Alright, this time I will assess the rashes that we looked earlier, ma'am, okay? May I have your forearm po? Alright, with my fingers, I will just apply pressure on the area with rashes and check for blanching, okay? Okay. Blanching is the whitening of the skin with applied pressure, ma'am. Okay, other forearm. Okay, ma'am. So, usually for rashes po, we apply pressure on the area to assess for blanching because blood leaves pressure and we are wearing gloves to avoid risk of infection. Now that I am done, I will dispose the used gloves. So this time, I will check the nails of my patient. Okay, ma'am. Can I see your nails po? Okay, I can see that they are clean and well manicured and it's pink tone. And I also did not see any fungal problems po. Okay? Okay. Nails are hard and also it is firmly attached to the nail bed and not moving at all. So this time, I will check for the shape of the nails. Ma'am, can you please do this for me po? Okay? Form a diamond po. Okay. Can you left your hand po? Okay. Alright. For the shape of your nails, ma'am, I can see that it is less than 180 degrees. 180 degrees angle between your nail bed and skin. There are no clumping din po. Okay. So this time, I will check for a capillary refill on your nails. Okay? So, the capillary refill is less than 2 seconds. And it is usually indicated by the immediate return of the pink tone of your nails. And it is normal within less than 2 seconds. Okay, for the last part, I will be palpating for edema. I'll use my thumb to apply pressure of her feet. So what we want to see for a normal finding here is the skin should rebound and there should be no indentation left on her feet. So alright, for this case, I will do the procedure. Okay, so I already performed a hand hygiene and also wear a gloves. So, okay, so can I have your foot, ma'am? Okay. Another one po, please. Thank you so much, ma'am. Okay. Alright, for this case, there is no indentation are found. So, therefore, there is no signs of edema. Okay. After touching the patient's foot, let us get the gloves that we used and then dispose it into the proper receptacle and perform hand hygiene. Okay, ma'am, now that we are done with the assessment, I will sum up everything that I noted to double check and clarify, alright? So, your skin is consistent with even pigmentation in the lighter or darker areas. No yellow pigmentation on the skin. A red and itchy area is found on both forearms. Skin moisture is normal. Skin is warm to touch, and skin texture is smooth in most areas and only feels rough on palms. Also, the skin can be pinched easily and returns to its position, indicating normal mobility and turgor. No indentation on the feet, therefore no signs of edema. The nails are clean, the color and shape of the nails are normal, and the texture is hard and immobile, smooth and firm. And the capillary refill is less than 2 seconds. So ma'am, your hair and nails are in great condition, but it is more important to maintain them by keeping yourself hydrated and drinking lots of water for at least 2 liters per day. Okay, so for your current health concern, ma'am, you have impaired skin integrity related to irritation or allergies, but for this time, just avoid using the soap for now and perform proper hand hygiene at all times, okay? And I think that's it. I have the results of the assessment and I'll just head out to give it to the attending physician, okay? So, Miss Leia, do you have any concern, clarifications, or questions po? Okay. So, thank you so much, ma'am, for your cooperation. I'll just perform hand hygiene and you can also perform it po. We will just call you for any follow-up interviews or tests you need to take, okay? Thank you so much, ma'am, and have a great day ahead. See you next time.